This Good to Go segment is sponsored by Corewell Health.
Lots of people complain about a painful knee, hip, or shoulder. But if your pain is severe and it's affecting your quality of life, you may find relief through a joint replacement. Corewell Health has a long history of excellence in helping patients with joint pain improve their mobility and get back to living their best life. Here to talk about the latest in joint replacement surgery is Dr. Brian Camps from Corewell Health, Pennock Hospital in Hastings. Hi, Dr. Camps.
Hi, Catherine. Thanks for having me.
Oh, I am happy to. Tell me, what is joint replacement surgery?
Essentially, what we do is we replace worn out joint surfaces with smooth metal and plastic bearings.
Hmm.
That's it in a nutshell.
Who's a candidate for that?
It would be somebody who has severe arthritis and who is having pain that is interfering with their activities of daily living. So basically, I tell patients, well, if you have severe arthritis and you just can't do the things you want to do, that's the time to think about doing a joint replacement.
Specifically, how do you replace a joint? I know you gave me the simple, spitball description, but what do
Yep.
you do when you replace a joint?
Well, it requires surgery. If I may, here's a knee replacement.
Yes.
Looking a little fuzzy there, but that's
Yep.
what we put in a knee. Quickly, if I can get this out. There's a knee or a hip replacement.
Okay.
And that's what we put in a hip. So it's surgery. We remove just a small part of the joint surface, and then we replace that joint surface with, like I said, the metal and plastic bearings.
I am guessing that both the procedure and the artificial joints, they have changed over time. You're probably working with a much improved product and procedure.
We have made a lot of changes in how we do the surgery, from changing the materials that we use so they wear more slowly, to the types of anesthetics we use, so that we have much better pain control after surgery. We use newer medications that allow us to decrease blood loss, so it's very rare for us to have to give patients blood after surgery. So that's just a few of the things that we've changed a lot in the last few years that have really improved our outcomes.
Is a joint replacement like sort of the end of the line, the last option? Are there other things you can do to alleviate pain and discomfort?
We can offer things like physical therapy, braces, steroid injections, anti-inflammatory medications. Weight loss a lot of times will help with joint pain. So those are a lot of the non-surgical type things that we will talk about. And then I always hate to use last resort, but sometimes it's actually the first resort, because it's obvious that the arthritis is so severe that some of the non-surgical things just aren't going to help.
Yeah. I imagine that I might beep in the airport with that thing in me. Are there other restrictions that I have to know about living with an artificial joint?
Not a lot. The main thing with hip replacements is that we have to be careful about dislocations after surgery. So we counsel patients and show patients things that they should be careful about so they don't dislocate.
Mm. How about the length of time that joint will last for a patient?
In broad strokes, for both hip and knee replacements, after about 10 years, 95% of them are still good. It drops off slowly. So at about 20 years, 85% of them are still good. So I tell patients, even at 20 years, the likelihood that their joint is going to still be good for them is really quite good.
That is amazing. I'm guessing that you have heard stories from your patients about how their lives have been transformed by this experience.
Yeah, I mean, it's why I love doing this. Patients come back at 6 weeks or so after surgery, and they're loving it. It really is very helpful for people.
What do you say to someone who's thinking about it?
Well, kind of like you see on TV all the time, talk to your doctor. Talk to your primary care provider about it. Usually they will refer to me or to someone who does joint replacement. And we are very happy to talk to people about it and give them our best advice.
See if it's right for them. Okay. For more information or to schedule that first appointment, visit spectrumhealth.org/everystep. Dr. Camps, thank you.
Thank you, Catherine.